Neurocon. And so we will be just starting some of the important lectures, some of the important topics, some of the important presentations which are seen around in some of the conferences which are coming ahead and which were previously deliberated. And this presentation would be, I guess, helpful to the MBBS students, to the postgraduate students, to the faculty involved in anatomy, neurophysiology, neuroanatomy, neurology, neuropsychiatry, and multiple other branches. So as far as my topics are concerned, they will be precise, brief, and I will be giving a prelude to some of the very important topics which are there. So let's start with my presentation over here. So as far as the presentation is concerned, the first topic I will be dealing with will be the brain architecture across lifespan, which was destined for some important event, but due to my engagements, I could not attend to that event. And here I am presenting a prelude to this very important topic, which will be of a lot of help to the medical fraternity as a whole. So overall, the topic, as I mentioned, brain architecture across lifespan. What we mean by resilience, what we mean by vulnerability, and the different neurological diseases which I will be covering over here. So as far as this topic is concerned, what would be my learning objectives? So I would be mapping the brain changes from development to senescence. That means from a young age to the old age, and define the balance which is disturbed in case of selected neurological disorders, and linking the stages to key neurological disorder. That means what neurological disorders occur in childhood, what the ability of a neurological disorder to start at a young age starts, and in addition to that, identifying some of the vulnerabilities, whether they are genetic or whether they are environmental, and then what are the protective mechanisms by virtue of nature, by virtue of natural causes which help, and that is what we refer to as plasticity. So as we go, we track the events starting from early life, going to the adulthood, going to the midlife, and going to the aging or the senescence. Now, important is what are the two important processes which help in the development of the nervous system. I mean to say in a positive manner. One is synaptogenesis and second is pruning. And what do we mean by synaptogenesis? Means that the synaptic connections or the formation of synapses has to be highly precise, time bound, and as far as the pruning is concerned, what is pruning? Once we do something wrong, there are some natural mechanisms or induced mechanisms which help in removing the vulnerabilities or which help in removing the incorrections in the system. So pruning is a mechanism which is very protective, which is effective in removing some of the fundamental defects which can occur during this process. So correct synaptogenesis and high level of pruning are the foundation of important and significant and corrective neurogenesis as a whole. So as far as that is concerned now, we take an example of certain childhood disorders, the disorders which occur at early age of life. And one of the important disorders which affects many families in a very negative manner is the autism. And as a whole, we give this the name from psychiatric viewpoint, autistic spectrum disorder, ASD. And there are so many children, unfortunately, who have got this issue that they face issues right from their beginning, and they are socially isolated. That means they have got impaired social communication. They are not integrative. They do not integrate with each other. They are not active in a manner they should be, and they might be having repetitive behavior and restriction of interest. That's very important. That is what makes moms and dads very, very, I mean to say, emotional about these children who are having autism. And it is seen in many families. In fact, many families in our, I mean to say, surroundings. I myself am a witness to some of these autistic children, and it is very, 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 I mean to say, it makes one very sad, depressed to see these children, and they have got impaired theory of mind. So this is one set of individuals wherein they have got decreased communication levels, decreased integration, decreased behavior, and restricted activity, restricted interests. Now, on the other hand, a very opposite type of a disorder, ADHD, attention deficient hyperkinetic disorder. And in here, what is here? The child who moves a lot, who is very, very hyperactive, is almost restless, and there is no scope for attention. He cannot fix his attention. That means he is inattentive, and there's a lot of impulsivity in these children. So autism and ADHD, they happen to be two oppositely, diametrically opposite disorders which are seen in early age. So that is very important. And what is the important? The important is the architectural bases are laid in the prefrontal cortical circuits at a very early age. So that's important. So this is a North Pole, South Pole sort of a distinction of the diseases. Now, once we move from this stage, early stage of life, then to the adolescent, and there are certain changes which occur in adolescence, as you are well aware: hormonal changes, architectural changes, and what is important at this period, there's the importance that there is an aggressive, very, very aggressive thing, which I told you previously: synaptogenesis and pruning. So this stage is very important, because in this stage there is a defective pruning, there's a defective synaptogenesis that can lead to ailments at a later part of life, and there will be those, the executive control, the emotional circuits, and the emotional volatility will be there. That means the seeds of certain disorders are laid in adolescence. So that's very important, you have to remember. So you have to drive a car, it should be having all the things intact. And I mean to say, the gear should be fine. I mean to say, the brake should be fine, the accelerator should be fine. So in a manner, in case something goes wrong, they are prone to have accidents. So that is what this picture depicts. Now, coming to some of the facts at this stage of life, what can be the factors which can lead to some disorders, whether in the early stage of life or in the late stage of life? So there is the genetic blueprint. You mean I will not go into the basics of genetics, what we mean. There are certain things, say, for example, there are certain diseases like Alzheimer's disease. There are certain diseases like Parkinson's disease or paralysis agitans. And there is this amyotrophic lateral sclerosis, though they are not present at a very early age in most cases. But you see that there is a form of dementia, Alzheimer's presenile, and a Parkinsonism can also set in early, or ALS can also set in very early. And these are some of the conditions which can be very lethal, particularly the amyotrophic lateral sclerosis, ALS. So there are these genes, APP gene and PSEN1 and 2, which are there for Alzheimer's disease. They lay the foundations for Alzheimer's at a very early age. Then PARKIN1 and PINKY1, and they can just cause early onset of Parkinsonism. And then C9 or 72 factor, which can be a very important causative factor in case of amyotrophic lateral sclerosis. So these are very important. The stage of life is very important. And then going down at a pathological level, what we can see, there can be those architectural changes. There can be the hits from the environment or the genes. And especially there, as far as the pathology is concerned, there can be protein aggregation, which starts at a very early life. And then what happens? This is the period once there's a transition from a preclinical to prodromal stage. And this phase of disease is important, because one cannot usually recognize this phase of disease, and this is where in the disease process sets in. Now going to this function, this disease, amyotrophic lateral sclerosis, a functional disability. And what happens in this, there is the death of the upper motor neuron lesion. It's the death of upper motor neuron or upper motor neuron lesion, or the lower motor neuron. And there is asymmetric weakness, fasciculations and cramping. And unfortunately, many of these patients just, they die within a period of months. and the bases are laid very early. They die of some different causes, maybe due to cardiomyopathy, due to respiratory failure, but the important is the nervous control is gone, and the nervous control is the basic cause of death, which causes cardiomyopathy or which causes respiratory embarrassment and all those things. So I will not go into the clinical details of that, as one of my guides told that we should not go too much into the presentations as far as the clinical perspective is concerned. But I somehow wonder that some of the people who are concerned with basic sciences, they do not have much of the knowledge about the neurology, the neuropsychiatry, the psychiatric ailments, and how to coordinate the things. So in that view, it's very important to have a correlation between, because there are no boundaries in medicine, surgery, and all those things. The basic of anatomy, physiology, biochemistry is important, and that's how we correlate neuroanatomy with neurophysiology, neuroanatomy with neurology, and it is mathematical. It is not upper limb, lower limb. So neurology is mathematical, and one should have a profound knowledge to link things. So that's important. Now, as far as Parkinson's disease is concerned, we call it paralysis agitans, and there are so many features associated with it. I mean, the primarily would be a mask-like facies, tremor, 4 to 6 hertz tremor, the shuffling gait or the instability in the gait, then drooling of saliva, and all those things. I will not go much into that. By this, the bradykinesia, or in severe cases, akinesia. Brady means they have a lesser amount of movement, and akinesia once it is too severe, so they cannot move even. And the rigidity associated with Parkinson's disease, so you all know that. But overall, what is important is that we have, in addition to these features, some premotor markers. That means these patients have anosmia, these patients may have constipation, and they might be having changes in their REM sleep pattern. So that's important. Now, what basically are the pathogenic markers which cause these diseases? And I will not take these diseases separately. There's a lot of stress on oxidative stress and the use of antioxidants. How much of the antioxidants are helpful, I'm not sure, but surely oxidative stress is one important factor which is the bottom line, which is the mainstream of causing these diseases. Then inflammation, and specifically here it is neuroinflammation, the inflammation of the nerves, nerve filaments, the nerve bundles, the nerves, and maybe larger parts of the nervous system. I mean to say the tracts, because in so many cases there is the funicular involvement, there is the white matter involvement, isn't it? So that's it, whether it's the ascending tracts or the descending tracts. So there is neuroinflammation. Then important protein aggregation, alpha-synuclein, and the amyloid deposition in certain disorders. Then the basic is the mitochondrial dysfunction. Mitochondria, very metabolic, the metabolic activity of all the cells lies within the mitochondria, and in case there is mitochondrial dysfunction, it causes a lot of issues. And overall, what happens? There is this neuronal apoptosis. All these factors add to something which is neuronal apoptosis or programmed cell death, PCD. So neuronal apoptosis or PCD, everything is programmed. So these are the vulnerabilities which can cause neuronal apoptosis, and neuronal apoptosis is a basic biochemical marker of many of these diseases which I mentioned just now. Now, what happens, fortunately or unfortunately, there's this aging process, and brain is no immune to aging. And in fact, the aging of the brain is something which is causing lots of issues in our later life. And what happens, there is this cortical atrophy, maybe widespread or maybe frontotemporal, as in case of Pick's disease. And there can be all the lobes involved, the temporal lobes, the occipital lobes, the frontal lobes, as I mentioned. And there might be what happens, the amyloid clearance is not there pathologically, and amyloid needs to be cleared. Amyloid deposition causes subtle changes in the brain. So that's second thing. And number third is the what happens with aging, that there is the capacity of the brain. Brain has got a threshold to handle the stress, and handling the energetic crisis is very hard in old age. So you can see that the atrophic brain is vulnerable, and there might be associated hippocampal atrophy and the cortical thinning. all these things contribute to our cognitive decline, alexia, acalculia, agraphia, so many things which are important from a perspective of Alzheimer's or other types of dementia, which I will not touch at this point of time. Now, I was just mentioning Alzheimer's, and you can see that in the Alzheimer's dementia, especially, there's the medial temporal lobe atrophy and there's this memory loss. So there are those memory circuits in the brain. And in case of Alzheimer's disease, because of the widespread neural connections, there is, there are these connections, and these connections get disrupted. And what happens? There is amyloid deposition, extracellular amyloid plaques may be seen, intracellular neurofibrillary tangles may be seen, and there is this temporal lobe atrophy, classic of Alzheimer's dementia. So, and there are these genetic risk factors, ApoE, Ali types, which can lead to Alzheimer's disease. So that's very important. Now, Parkinson's, I mentioned you the features. I just over here, tremor, rigidity, bradykinesia, postural instability. That means a trap syndrome. We call it the trap. T for tremor, R for rigidity, B for bradykinesia, P for postural instability. So that's important. And what happens? There is this nucleus. There are very important areas in the brain: the locus coeruleus, the substantia nigra, the lentiform nucleus, the basal ganglia, other parts. So this is the substantia nigra. Why we call it substantia nigra? Bluish substance over here because of the high content of iron, ferruginous. So substantia nigra is the basic nucleus which is involved in Parkinson's disease from a neuroanatomical perspective, as was told to me by my madam, that anatomy should not be described much, or it should be described, in relation to the clinical scenario. So substantia nigra is a very important nucleus, and over here, this is the area which gets damaged in case of Parkinson's disease. Hepatolenticular degeneration, I will not mention here Wilson's disease, which we call in there the lentiform nucleus gets, damaged. In other movement disorders, choreoathetosis, there are the basal ganglia which get affected. So one has to be very much pretty sure about which nucleus we're talking about. Now, so why does the balance lie? So who is susceptible to the neurological disorders? And there are so many factors. There can be, so the balance lies between the risk factors and the protective factors. And what are the risk factors? I told you the genetic susceptibility, the genes which are involved. Then there might be environmental factors like toxins, like pesticides, lead, mercury, in which form we take, we're well aware. Then there might be some important diseases like diabetes, hypertension, which predispose to these disorders and increase the risk of, acquiring these disorders. Then protective mechanisms, which do not usually play a much role, because had these been protected, then nobody would have these diseases. So exercise, effective exercise, yeah, that help, but to what extent, I'm not sure. Caffeine, cognitive engagement, social activity. So one has to be socially active. The cognition should be there. That means to remain busy with job, being active job. These are some of the factors. Antioxidants intake. So they can be just tipping the balance in favor of protective factors and less liability to get diseases. But overall, we don't see that these really work in real life. So then the last thing to mention is plasticity, the power of plasticity as a neuroprotection. So does the brain have some auto-regulation about controlling the, damage? Yeah, that is what we call as plasticity, the brain's ability to reorganize its structure. So it is very, very important. It's a dynamic concept, the neuroplasticity, and that is what may afford a part of protection towards these disorders. And the research should be focused more on neuroplasticity, neuroprotection, and that is the field which is a lot many researchers, a lot many scholars and scientists are working upon. So the functional capacity of the brain needs to be revived. And what are these factors? These factors are multiple. So that means these plasticity factors help in recognizing the synaptic misconnections, disconnections, and they help in protecting the brain from the insults. And this neuroplasticity is one important factor which has got multiple, segments. That means the functional compensation is there, the cognitive reserve comes into being, and the metabolic defense. As I told you, mitochondrial dysfunction can be averted by certain mechanisms, and that can be at the molecular level, at the cellular level. Then there can be genetic, we can modify, there can be genetic modification of certain genes which can help. And overall, we can expand this scope of neuroplasticity and neural protection to multiple things. Then there are certain, signal molecules and recognize certain substances, physiologically active substances, which play a very crucial role in brain damage. And we can just have, say, for example, there is this APP, amyloid precursor protein, and its pathogenic role. And we can just elaborate on so many neuroprotective factors which are there. So, and in addition to that, there is the brain's lysosomal clearance systems, which are very important for clearing these misfolded proteins, because there are so many diseases which are a result of misfolded proteins. So lysosomal clearance, amyloid precursor protein like substances, then the lifestyle modification which I earlier mentioned, they have a slight role in neuromodulation. Active physical exercise, being cognitively active, can have positive effects on the neuroreorganization part of the brain. So these factors are important, and what should we look forward to? So in forward, we are looking to something precision medicine, clearing the pathological barriers. So we identify the pathological barriers wherever they exist, and we clear them the way it is done in a war. So we clear some of the areas, move to the next area, invade the next territory. So that's important. So what is there? So I will not go into the pharmacological things like the monoclonal antibodies, so many of them. So it is the age of monoclonal antibodies, how they are changing the course of medicine and the course of certain disorders. That is one. So precisely targeting the pathological barriers. Then genetic enhancers, that's very important. They restore the internal defenses. So what we do, we manipulate the genes. We manipulate the genes at a level that they become very much resistant to oxidative stress, and they help the body in resilience. So the genes are modified, making the process highly selective. And what is it? By targeting these genes, we can bolster the brain's own maintenance system. So it is a sort of auto repair which we are enhancing. So this is something where we can just help so many, families, because whether it is autism or whether it is ADHD in case of early childhood, or whether it is the old age Alzheimer's, Parkinson's disease, and multiple other diseases, we have to have our research focused on these things. And I hope that neuroprotection is a shield and plasticity is the rapier crew. So we have to focus on, neuroprotection, plasticity. Our research should be focused towards these things. The pharmacology people will take off antibodies, monoclonal antibodies, and all those things. And we as neuroanatomists, neurologists, neuropsychiatrists, neurosurgeons, we have got a role in these things. And overall, I wish you best of luck, and thanks a lot for your patience listening. I hope that this small talk of the benefits to you to a maximum extent, and I would be welcome to any queries, and you can put your criticism in case you watch this video. So I would not be expecting you to post only positive views. I would be very happy to have a critical analysis of my video. Thanks a lot. Wish you best of luck and best of health, and happy belated New Year. Thanks a lot.